Accessia Health Education presents Coverage Options, Important Terms. All health insurance terms are important to know, but today we're going to look at some common terms you'll see when searching for the right plan to meet your needs. The first term we'll look at today is the health insurance premium. This is the amount you must pay monthly to have health insurance benefits. The premium may be paid directly to an insurance company. It may be deducted from an employee or retiree pay stub, or it may be deducted from your Social Security check. There are three important things to remember about the premium. First, the premium must be paid whether you use the insurance or not. Second, premium payments are time sensitive, and if not paid by the date due, insurance can cancel. And three, if you lose coverage for failure to pay the premium, you generally cannot re enroll until open enrollment or a special enrollment period. The next term we'll discuss is the deductible. This is the amount you must pay for most covered services before the plan will start contributing to the cost. Some services may be covered before you meet the deductible. After the deductible has been met, the plan will start to cover the item or service, and you generally will pay a copayment or coinsurance. Let's look at an example of a deductible. If the plan benefits have a $1,000 deductible and the member needs a medical test that costs $2,000, the member will pay the first $1,000 if that test is subject to a deductible. And then the member will pay a copayment or coinsurance on the remaining amount. In most cases, the deductible only has to be met once per plan year. The next term we'll review is a copayment, also referred to as a copay. This is a fixed dollar amount you pay for a covered item or service. The important thing to remember about a copay is that it is a set amount you'll pay each time you use the covered benefit. For example, a plan may cover an in network primary care office visit with a $25 copay. And if this were the benefit, you would pay that same $25 for each primary care office visit as long as the provider was in network. Similar to a copay is the term coinsurance. A coinsurance is the percentage amount you pay for a covered item or service. The important thing to remember about a coinsurance is that the amount you pay is based on the total cost of the item or service. For example, if a plan covers an imaging test with a 20% coinsurance and the total cost of that test is $2,000, the 20% coinsurance cost would be $400. Healthcare costs can add up throughout the year. That's why the next term is especially important. An out of pocket maximum is the maximum amount you have to pay for covered services in a plan year. Once the out of pocket maximum has been met, the health plan pays 100% of the cost for most covered services for the remainder of the plan year. However, there are some costs that don't count towards the out of pocket maximum. They include the monthly premiums you pay, the amount you spend on services your plan doesn't cover, and costs that a provider may charge that exceeds the allowed amount, also known as balance billing. One way to avoid some of those uncovered costs is to search the plan's network and formulary to ensure your providers and medications are covered. Therefore, we'll look at these terms next. A provider network consists of the facilities, providers, and suppliers the plan has contracted with to provide healthcare services. Some plans may offer out of network coverage, and if they do, those out of network services generally cost more. Next, let's look at the term formulary. The formulary is a list of prescription drugs covered by the plan. Each plan has their own formulary of medications they will cover, which are usually listed in tiers. Formulary tiers categorize medications by cost, with the lower tiers being the least expensive medications. Some plans have only 3 tiers, and some can have as many as 5 or 6. Medications on the formulary may also have restrictions, which are additional requirements that must be met before the medication will be covered. Now, let's review the terms associated with those restrictions. You may see the abbreviation PA, which is prior authorization. This means coverage approval is needed by the plan. ST is step therapy. Step therapy means you must try a less expensive medication first. And QL is quantity limits. This limits the amount of the medication you can fill at one time. There are many more health insurance terms to know, as today we just reviewed some basic terms. To learn more, you can always request a glossary of terms from your insurance provider. And also, stay tuned for more educational videos from Accessia Health. Health insurance terminology can be overwhelming. However, when you take the time to understand each term, it helps bring things together for a clearer understanding of what's ahead. Thank you for joining us today. And remember, if you have a health insurance topic or term you would like to see discussed here, email us at casemanagement@accessiahealth.org.